Hi guys, good morning to all. Welcome to today's video. As a continuation of psychiatric nursing, today we'll see the third set of MCQs. Okay. So if you are new to our channel, please subscribe to our channel and press the bell icon to get the daily updates. Okay. So today we'll see the practical oriented MCQs in psychiatric nursing. Okay. So yesterday itself I told the first major part of MCQs in psychiatric nursing. Today we'll see the second major part of MCQ nursing. If you didn't watch the yesterday video, please do watch yesterday's psychiatric nursing part 2. Okay, let's move on to the today's video. Okay, first MCQ. Which one of the following communication technique to be used for a client who is experiencing disordered thinking about food being poisoned? Okay, so you are in a ward, a patient is there, patient is telling that the food is being poisoned. Okay, how will you react in that situation? So option A, focusing on self-disclosure of own food preferences, offering opinion about the need to eat, verbalizing reasons that the client may not choose to eat, using open-ended questions and silence. Okay, so let's discuss the options. Focusing on self-disclosure, you should not disclose about yourself to the patient. Okay, so option A is not the answer. Option B, offering opinion about the need to eat. That's also not a right option. Okay, so the patient is already having suspiciousness whether the food is poisoned or not. Okay, so you should not emphasize or stress them to eat. Okay, verbalizing the reasons that the client may not choose to eat. That's also won't come. So the right answer is using open-ended questions and silence. Okay, most of the situation always use open-ended questions. Okay, and remain calm with the patient who are agitated and who are being having any delusion or hallucination. Okay, so clear. Let's move on to the next MCQ. A nurse is caring for a female client who has suicidal tendencies. A nurse should give her privacy, allow her to urinate, open the window and allow her to get some fresh air, observe her. Okay, so this question is, you are in a ward, you are having a doubt that a person might commit suicide. Okay, what you do? Okay, so first option A, give her privacy. If you give her privacy, surely she will commit suicide. Okay, should not encourage her to give her a privacy. Okay, then allow her to urinate. Okay, so you should not allow her to urinate. Means if they are going to washroom and all, they may commit suicide. Okay, should allow with the attendant to go to washroom. Okay, open the window and allow her to get some fresh air. It's somewhat okay. And fourth option is observe her. So I hope the correct answer will be observe her. Okay, so the third option is also somewhat okay, but the ideal answer is observe her. Okay, whenever a person is on suicidal tendencies, the best method to manage them is keep an eye on them. Okay, always keep an eye on them. Okay, observe her what they are doing. Okay, coming to the next MCQ, the most appropriate nursing intervention for a patient experiencing anxiety attack is. Okay, what is anxiety? Okay, suppose you are going for a exam, that time you will get anxiety. Okay, what is anxiety attack? When the level of the anxiety is going to a higher level, that time you experience some sort of physical symptoms, that is known as anxiety attack. Okay, so the person is on anxiety attack. As a nurse, what you will do? That's the question. Okay, option A, encourage client to exercise to reduce anxiety, give her privacy, open the window and allow her to get some fresh air, staying with the client and speaking in short sentences. Okay, so option A, you should not ask them to exercise and all. They are already in anxiety attack, means palpitations will be there. You should not ask them to work out also. Okay. Again, give her privacy. That's also will increase the anxiety attack. Okay. Open the window and allow her to get some fresh air. It's somewhat okay with me. And staying with the client and speaking in short sentences. I hope the answer is staying with the client and speaking in short sentences. Okay. Should stay with the patient. Okay. If the patient is in anxiety attack, stay with the patient and you should speak a little only. And should not, your voice also in a minimal. Okay. You should not use high pitched voice also. It will increase the anxiety. So, you should remain with the patient and reassure the patient, and you should speak in a soft voice and in a short sentences. Okay, that is the most appropriate nursing intervention for a patient who is on anxiety attack. Okay, coming to the next MCQ, which one of the following is the most important goal for a patient with bulimia nervosa? Okay, what is bulimia nervosa? Please comment in comment box. Okay, so what is bulimia nervosa? So option A, eat only 3 meals a day, avoid purchasing high calorie food items, identify anxiety causes situation. Option D, encourage to avoid foods. Okay, what is bulimia nervosa? The patient will eat more. Okay, so option A, what was option A? Eat only 3 meals a day. That is somewhat okay. Avoid purchasing high calorie food items. That is also okay. Identify anxiety causes situation. That is okay. Option D, encourage to avoid foods. That is not okay. So we have taken out odd one out. Okay. So what is bulimia nervosa? Bulimia nervosa occurs only when the patient is experiencing anxiety. Okay. So the most important goal for a patient with bulimia nervosa is identify anxiety causes situation. Whenever the patient gets anxiety, they are to reduce that anxiety, they are taking food. Okay, that is bulimia nervosa in simple words. Okay, so to prevent bulimia nervosa, if you prevent anxiety, it will be prevented. Okay, so that is the goal. Okay, that is the key point. Okay, if you prevent the anxiety, bulimia nervosa will be prevented. Okay, that's all. Coming to the next MCQ, how can an agitation in a disturbed client be minimized? Okay, so patient is agitated, how you can minimize? Increasing stimulation won't. It will increase the agitation, right? So the option A is not answer. Option B, limiting unnecessary interaction. Yeah, it is okay. You should not interact more. It will increase the agitation. Option C, increasing appropriate sensory perception. It's also okay, but not a good option. Okay, ensuring constant client and staff contact. Okay, it means you should have a frequent contact with the patient. If a patient is agitated, as a nurse, you should limit unnecessary interaction. Okay, so it will increase their agitation. Okay, so whenever a patient is in agitation, try to minimize the interaction with the patient. Okay, whenever they are in need, that time only you should interact with the patient. Okay, so that is the most appropriate nursing intervention for a patient is on agitation. Okay, so let me summarize today's video. If a patient is in depression, observe her, keep an eye on her. Okay, if a patient is on bulimia nervosa, reduce the anxiety causing situations. Okay, if a patient is in anxiety attack, what you will do? Stay with the patient and reassure the patient. Okay, then if a patient is disturbed, don't go to the patient room unnecessarily. Okay, so in previous video I told, if you take any question paper all over India MCQs, In psychiatry, we'll get minimum 4 to 5 questions. In that 4 to 5 questions, one will be come from therapeutic related. Okay, means management point of view. Either they will ask from antipsychotic, antidepressant, lithium, or ECT or therapies. Okay, Milu therapy, behavioral therapy, systemic desensitization, like that. Okay, if they didn't ask from that point, second most important topic in psychiatry is this one. Okay, practical oriented questions. The patient is in depression, what you do? The patient is in anxiety, what you do? The patient is in mania, what you do? Okay, like that the questions will be asked. Okay, so that's all about today's video. If you are new to our channel Nursing Update, please subscribe and press the bell icon. Hope you guys like our videos. So put a like button also and share with your friends also. The more the views are, it will motivate me to do more videos. Thank you so much, guys. Thank you for today's video.